Okay. Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Please show your face in the video. As a reminder, please take the online Learning Kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to one voucher to a ROJoson telemedical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face. One, two, three. All of you can hear me, no? Okay. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. So by May 15, we will be completing the 3rd year presentation of this pep talk. My pep talk today is entitled Breast Self-Exam, a Health Habit to Cultivate. This pep talk is part of the promotion or promoting activities and requirements in the Breast Self-Exam Awards, which we discussed last week. The empowerment objective is to have an understanding of the importance of cultivating breast self-examination as a health habit in the light of high incidence of breast cancer. So in the light of breast cancer being the most common cancer in the world and in the Philippines, all females with breasts should always be on guard for breast cancer development in order to catch it as early as possible and then consult and have it treated as early as possible to avoid the high death rate in advanced stage. Another reason why all females with breasts should always be on guard for breast cancer development is that up to now, we don't know its exact cause. So there is really no effective and practical way of prevention. It can strike anybody, as no female is totally immune from it. It can strike anytime, and we don't know when that will be. So how should Filipino females be on guard for breast cancer development in order to catch it as early as possible? Currently, there are 3 ways. Number 1, breast self-exam. Number 2, breast specialist clinical examination. And then number 3, imaging procedures. Examples are the mammography and the ultrasound. And what should be the sequential order? Which should be first, which one should be last, okay? On the guarding for breast cancer development. Always start with breast self-examination, then breast specialist clinical examination as indicated. And lastly, do the imaging procedures as indicated kung kailangan lang. So why start with the breast self-examination or BSE as the first and foremost strategy in being on guard against breast cancer development? Number 1, because you carry your breast all the time, day in and day out, or the females usually carry their breast day in, day out. You can easily examine your breast at any time and anywhere. Breast self-examination costs nothing at all, libre yun, no medical expense whatsoever. And it is simple and can be mastered as long as you are committed and willing to learn to protect yourself from breast cancer. So make breast self-examination a health habit. Cultivate this habit. If you love yourself, if you want to be on guard against breast cancer, and if you want to avoid the suffering and death from breast cancer. My advice is do not omit breast self-examination and jump to the second and third way, which is the common thing that's practically everybody's doing. They forget about BSE. They go right away to imaging procedures. Okay. So do not go to breast specialist clinical examination first, but do the BSE first, and then don't also jump into doing the mammography and ultrasound. Why this is so? If you do BSE regularly, particularly monthly, if you are committed and trained to do it, you are in the better position to catch the breast cancer early. If you do BSE regularly, particularly monthly, and if you are committed and trained to do it, you are in a better position to detect the breast cancer early. So better than a breast specialist like me, particularly for a starting small breast cancer, because you are more familiar, because you carry your own breast every time, every minute, every second, you're more familiar with the feel of your breast and any abnormality that may appear there. Okay. So again, do not jump or do not omit BSE and jump to the breast specialist and imaging procedures right away without developing a habit of doing BSE. The other reason why you should not omit BSE is that you have more opportunities to feel and palpate your breast daily. You can do it 3 times, 4 times, 5 times, again and again. Once you note of anything unusual, and breast specialist does not have this advantage. You can only see him once, okay, only for a few minutes, okay. Then the breast specialist may miss the small abnormality that is not evident on the surface. Note that the physician is not always 100% perfect or accurate. And also, the breast specialist may miss the small abnormality if you don't point it to her or him. If you are able to discover it, you have to point it to her, okay? So this is a big reason why you should do regular BSE and not omit it and just to rely on breast specialist examination, because you may be able to help the breast specialist in detecting a small breast cancer. So why not to omit BSE again? When you consult the breast specialist, he or she will and should always ask you initially whether you have felt an abnormal lump in your breast before he or she does the inspection and palpation. If you consult for a lump or a breast, the breast that you palpated on the breast, again, the breast specialist will and should always ask where you palpated the lump. Okay? And this shows the importance of doing BSE and supplying the breast specialist with the information from your BSE to help him make an accurate diagnosis. If there is an abnormal lump palpated by both you and the breast specialist, the latter means the breast specialist will ask you for information on the changes that may occur from the initial detection, or that has occurred from the initial detection to the time of the consultation. The breast specialist uses this information from your BSE to get an accurate diagnosis. Again, the big reason why you should do regular BSE and not omit it and just rely on the breast specialist examination, because you may be able to help the breast specialist make an accurate diagnosis. Another reason, a breast specialist has limitations. He or she is not always 100% accurate in his evaluation. he or she misses a breast cancer on a medical consultation, if she misses a breast cancer medical consultation, and if he or she asks for a breast check after 6 months or 1 year, so the cancer that was missed on the initial consult can be bigger or more advanced at the time of the next checkup, scheduled checkup. But if you do monthly BSE, you may be able to detect the breast cancer earlier by yourself and then go back to the breast specialist sooner than the next scheduled checkup. We don't know when breast cancer will appear and become evident. For example, if during a medical consultation, there was no evidence of cancer yet, the breast specialist advises breast checkup after 2 years. Example, after the initial consultation, the breast cancer becomes evident, say 6 months after. So if one relies on the breast specialist only without doing the BSE, the breast cancer can be bigger or more advanced at the time of the next scheduled checkup. This part in this example is when you go back to the breast specialist 2 years after the breast cancer has already grown bigger. So do regular BSE. Do not omit to just rely on the breast specialist. Your BSE will be of great importance. It can avoid missing a breast cancer by a breast specialist. It can assist in making an accurate diagnosis of a breast disorder. It can complement a breast specialist's objective of early detection, and it can also promote early detection of breast cancer by yourself. If you do BSE regularly, particularly monthly to repeat, if you are committed and trained to do it, you are in a better position to detect the breast cancer early and without the frequent uncertain readings and undue false alarms of the imaging procedures, specifically mammography and ultrasound. So there are a lot of undue false alarms in the imaging procedures. So BSE, if done properly, will be able to catch breast cancer as small as 1 centimeter, which is in the early stage pa. Okay. Although imaging procedures such as mammography and ultrasound can catch breast cancer less than 1 centimeter, they carry a lot of uncertain readings and false alarms, thereby causing undue anxiety and unwanted operations. Note here that the survival rates of stage 1 is, when you say stage 1, it's the size of the tumor is 1 centimeter or less than 2 centimeters of tumor size without lymph nodes. And then stage 0, less than 1 centimeter tumor size. The survival rates between the two, stage 1 and stage 2, have little difference. So specifically, based on statistics on the published data, stage 1, there's a 98% 5-year survival rate, and stage 0, 99% 5-year survival rate. So 1% difference lang. So why not omit BSE and jump to the third way? When you say third way, just relying on imaging procedures. Again, imaging procedures, just like the breast specialists, are not 100% accurate. They may miss and erroneously interpret lumps palpated by the patients in BSE and breast specialists in their clinical examination. And this can be corrected by the breast specialist examination and correlation with the BSE findings. BS imaging procedures are not always 100% accurate. I would like to emphasize that. They may miss breast cancer. If patients rely on imaging procedures and the next schedule is 1 to 2 years, or let's say 1 year, then the missed breast cancer can be bigger or more advanced at the time of the next scheduled procedures. But if you do it monthly, you may be able to detect the breast cancer earlier by yourself and then to the breast specialist sooner than the next scheduled checkup of 1 year to 2 years if you rely on the imaging procedures. Once report of imaging procedures come in, the breast specialist will correlate the findings with their physical findings and with the history of the patients, particularly on the BSE information of the patients if it is regularly done. So correlation of these three sets of data and information are important to come out with accurate diagnosis. So if you don't have do your BSE, you don't have data to present to your doctor, okay? And except for patients with high risk of breast cancer, where mammography is being recommended as a screening procedure, imaging procedure should be done only as indicated. That is only if there is an abnormality detected by the breast specialist and there is uncertainty in his diagnosis that a diagnostic test is needed. There are usually less false positives, false alarms in such situations. So do regular BSE, just to emphasize. Do not omit to just to rely on imaging procedures. Your BSE will be of great importance. You can avoid missing a breast cancer by the imaging procedure. It can assist in making the accurate diagnosis of breast cancer, meaning the BSE. It can complement imaging procedures' objective of early detection. And lastly, it can promote early detection of the breast cancer by yourself through the BSE. Currently, there are, again, to emphasize, currently there are 3 ways: breast self-examination, breast specialist clinical examination, and imaging procedures. And again, to repeat, the sequence should be start with BSE, then breast specialist clinical examination as indicated, and then imaging procedures as indicated. Now, why start with breast self-examination as the first and foremost strategy in being on guard against breast cancer development? Because you carry your breast all the time, day in, day out. You can easily examine your breast at any time, anywhere. Breast self-examination costs nothing at all, no medical expense whatsoever. It is simple and can be mastered as long as you're committed and willing to learn to protect yourself from breast cancer. Again, I want to emphasize, make BSE a health habit. Cultivate this habit. If you love yourself, if you want to be on guard against breast cancer, if you want to avoid the suffering and death from breast cancer. Do not be afraid to do BSE. Do not let the accuracy worry of doing BSE deter you from doing BSE. A lot of people say, we don't know, baka mali ang ginagawa namin, kaya hindi kami gumagawa ng BSE. So don't let that worry deter you from doing it. BSE can be learned, it can be mastered with no costs, okay, with proper education, with proper teaching, like this one that I'm doing. What is needed is commitment, discipline, and perseverance. Now, why a lot of women are afraid to doing BSE? One specific reason for warded is that they are afraid to find something fearsome, particularly breast cancer. Natatakot sila baka may makitang breast cancer. This is unfounded and is a detrimental attitude. You won't be able to detect breast cancer early if you rely on this attitude. And what is the solution here? Again, education, persuasion, and psychotherapy. If those who have a mindset that cannot be controlled, then we have to do psychotherapy. And then another reason for warded is belief that touching or palpating the breast may cause breast cancer. This is a myth. Hindi totoo. That has arisen from the belief that trauma or a bump, a bunggo lang, is a cause of breast cancer. The bump on the breast does not cause breast cancer. That is the fact. Now, why this myth? The background is that the usually painless yung mga breast cancer to start with. So painless and noticeable cancer has been there in the breast even before the bump, even before the trauma, before the nabunggo. One day when the bump occurs on the breast that contains the cancer, the person magre-reflex at hahawakan yung breast niya kasi masakit. Nabunggo kasi. The person reflexly touches her breast and lo and behold, the cancer is discovered. This is the origin of the myth, believing that the bump caused the breast cancer. So it is not true that the bump on the breast or touching or palpating the breast can cause breast cancer. So how do we remedy this myth? Okay, the solution is education and persuasion. So to convince the people that this myth is false. Okay. So another reason why they don't want to do BSE, because they will say, because we don't know how to do it. We don't know how to do it. Very superficial reason, but this is a common reason presented by a lot of patients, by a lot of lay people. And what is the solution here? Convince the lay people of the usefulness of BSE. This is what I'm doing now. Once they're convinced, teach them to do it properly. So before going on uh, lecturing, talking about how to do BSE, there are some essential pointers that I'd like to give you for you to remember. All women should start developing a habit of doing BSE as early as 18, adult na, as part of their preparedness program in detecting breast cancer in case one unfortunately develops in their body. Breast cancer is still rare in this age group, 18 or even below, okay, but it can occur, but usually rare siya. The breast cancer starts coming out at age 30 to 40. So at age 18 or 20, okay, there's a lead time of 10 years in developing breast BSE as a health habit in detecting early breast cancer. May lead time ng 20 if you started that 10, 18, or 20 years old. 18 ang usually recommended. BSE consists of inspection. When you say inspection, this is looking at anything unusual on the externals of the breast, on the surface of the breast. And palpation means feeling the breast for an abnormal mass. Kakapain lang. Okay? Isa, titingnan, kakapa. In palpation, one has to differentiate lumpy breast tissues from a real mass, which is medically called a dominant mass. Okay. So ito yung illustration here. Usually lumpy yung mga breast nyo, that's normal. Okay. But if you feel the so-called dominant mass which stands out from the rest, okay, different siya, then this is a red flag already. Okay. So again, to repeat, large photos, okay. Yung breast tissue surface usually hindi siya smooth because of hormonal changes. Okay, kung di kayo marunong kumapa, kung isa makakapa nyo, akala nyo bukol, pero hindi siya talagang bukol. No? Ang hahanapin niyo is really a dominant mass, which is described as one that stands out and different from the surrounding tissues. No? If you compare nyo on the other side, no? And then you have to use the flats of the fingers, huwag yung tips of the fingers. Because if you use the tips of the fingers, which are the most sensitive parts of the fingers, ang baka ma-mistake nyo ito yung mga lumpy breast nito into, you can mistake this for this dominant mass. Kaya importante, you use the flats of the fingers to palpate your breast and not the tips mo lang. For menstruating women, it's usually advisable to do BSE a few days after the last day of the mens, to avoid because may mga swelling dyan, hormonal swelling, para di kayo malito kung talagang bukol or just lumpy breast. Okay? So this is also to avoid the discomfort induced by palpating a breast that is usually sensitive during the time of menstruation. Kaya usually mga few days, can be 7 days, 10 days after the last day of the mens. For non-menstruating women, because to make it a routine, para di makalimutan, just choose either the first day or last day of the month for doing a monthly BSE for ease of memory. The first goal of the BSE is to look and feel for anything unusual. Hahanapin lang nyo, anything unusual is ito ang pinaka-basic objective. Once something unusual is found, either it is closely monitored for persistence, kung andyan pa rin for 1 day, 2 days, 3 days, okay, and it is brought to the attention of the breast specialist already. The self-monitoring of doubtful, unusual findings can be done with repeated BSE on the same day, subsequent days, or next month. So if you find something unusual, pwede pa niyong i-monitor the next day na wala na. So normal lang yon, no? Okay. So with BSE, you have the chance to do it as often as you can in doing the BSE to monitor it. No? Pwedeng 2 days, 3 days, or even the next month, pwede pa rin. The second goal of BSE is to try to interpret the unusual findings as much as able. If unable to, and a red flag is present, you have to consult a breast specialist already. So kung di nyo, if you feel hindi nyo alam, no, may doubt kayo, consult a breast specialist already. Or if you are thought that the findings, yung mga signs or red flag, then i-consult na nyo kagad. No? There are many techniques as there are authors. So you just doing the BSE. Choose one that is simple and practical to do as long as the endpoints of the goals are reached. Usually, especially the first goal is to look for something unusual. Okay. So there is a video here that I have, but I will not go through it anymore. Okay. Okay. So, eto na lang. Hindi na yung video. Medyo matagal yung video. So, first step is visual inspection by looking. Expose the upper body in a standing position in front of a mirror. Okay, face the mirror to view the entire chest and the breast. So, dapat cover itong area nito. Entire breast and the chest and also part of the neck. Okay. And then, with both arms and then raise over the head, itataas lang ninyo. Okay. Look for anything unusual on the breast. Kung may mga changes in dito, unusual changes pag tinaas niyo yung kamay ninyo. Okay. So look for changes in the contour. Ito, hindi siya pantay. No? Dapat nandito ito sa left side. No? May changes in the contour. So may bulb, may other findings that you can find will be baka may bulge siya, no? Kitang-kita, may skin dimpling, o baka may flattening or dimpling ang tawag o retraction, no? Okay. So look for anything unusual on that skin. Ito nakita niyo, mas mapula, parang may sugat, no? On the skin, redness and lesions. Okay. Then after the inspection, you do the palpation or what we call feeling. Okay. In a standing position with one arm raised over the head, tataas lang isang kamay when you're palpating the breast on that side. So as example, dito sa right side, pinapalpate yung right breast, itataas yung right arm. This is to stretch the muscles there para mas madaling, this is to promote yung mga accurate detection of breast lumps. Okay. And then use the flats of the 2 to 3 fingers. O kumisan, pwedeng 4 fingers. Okay. Yung flat, no? Hindi yung tips. Okay. Of the other hand, this one, the left hand, okay. Gently but firmly palpate the entire breast on the side where the arm is raised. Okay. Didiin lang at isusweep lang, kakapain lang. Hahanapin kung may dominant mass. So feel for anything unusual in the breast and feel for possible presence of the dominant mass. Ito yung goal, ito yung hahanapin. The dominant mass is usually defined as the unusual density distinct from the surrounding tissue, breast tissue, with a felt margin, may konting margin, which connotes a three-dimensional lump. So example, ito, outline of a mass meron. Okay, nakapalit ng isang pasyente. No? Then, when you palpate the breast, you cover the entire area. Okay? The entire you can divide it into 4 quadrants. Okay? So 1, 2, 3, 4. We can say inner upper quadrant, inner lower quadrant, outer lower quadrant, and outer upper quadrant. So basta ma-cover lahat ng breast niya. Okay? And before palpating the armpit, tapos na kayo sa breast, but meron pa isang gagawin, gently squeeze the nipple for possible presence of discharge and note the color of the discharge, whether hindi siya may dugo o walang dugo. Medyo dilaw o puti o milk o puti o milky. Ganon. When palpating the breast, the armpit, yung kilikili, kanina, pag pinapalpate yung breast, nakataas yung kamay, yung on the side, on the same side. Ngayon naman, kung kakapain yung kilikili, because you want to relax that skin doon para to have an accurate palpation, okay, ibababa itong kamay. And then gently but firmly press against the chest wall in the armpit and slowly glide the fingers downwards to feel for any unusual and to feel for any possible presence of a dominant mass. Usually lymph nodes ang hinahanap dyan. Repeat the same procedures on the other breast, the breast, then the nipple, and then the armpit. Okay, let's now go to the interpretations of the findings on the BSE. Okay. So if there is no dominant mass, wala kayong nakakapasa of physical examination, but you are complaining of breast mass, pero wala kang akala mo meron, pero nakapa mo, nung kinapa mo, wala naman. Okay. So the diagnosis is still normal fibrocystic changes. As I said, the goal is to look for a dominant mass. Kung no dominant mass, usually normal siya. Okay. So, but if there is pain, and then when you palpate yung breast mo, wala pa rin dominant mass, then wala rin problema yon. Most likely, it's a hormonal change or fibrocystic change. Okay. Basta importante, no mass, usually no problem. Pag may mass, may dominant mass, may problema. So, no dominant mass. Okay, ito naman, ito yung sa mga may mga nipple discharge, no? Pag may nipple discharge, hanapin nyo, i-determine nyo whether it's red or not red. Ganun na lang, okay? So if it's red, then there's something going on there. But kung walang bukol, the diagnosis is intraductal papilloma. There's a small tumor there, but usually benign siya, no? Ngayon, pag meron siyang discharge, hindi naman siya pula, okay, pero walang bukol, then that's still normal. Baka hormonal changes lang yan. No? Okay. And then focal erythema means redness, then tenderness, kung minsan may mainit, may lagnat, no? Then, kung walang bukol, then we call that mastitis or inflammation of the breast or infection of the breast, mastitis, no? Pero kung merong pigsa na doon sa parang pigsa doon sa breast, we call that breast abscess. So pag diniin mo, medyo malambot kasi parang may nana na sa loob, no? Fluctuant, no? Cystic mass, hindi siya mapula, no? Pag pinindot mo, parang may tubig, then we call that macrocyst. That's a benign condition also. Now, you suspect cancer. Number one, kung meron kang dominant mass with giveaway signs of malignancy. When you say giveaway signs of malignancy, you think of these three things, okay? Signs of local invasion on the adjacent tissues and signs of spread, okay? At least these two things, signs of local invasion and signs of spread. I will expound on this later on. And then you also suspect cancer if you have a red nipple discharge. Sanguinous means red nipple discharge, and there is an accompanying mass. Okay. So to guide alert signs for suspecting cancer, may dominant mass. Okay, palagi may dominant mass. Ito may red discharge. Ito naman, walang red discharge pero merong local signs of invasion and the signs of spread, which I will expound later on. Ito, signs of local invasions means, example will be, nakafix yung bukol, adjacent tissues, hindi gumagalaw, okay, either on the skin or nasa muscle, okay, hindi siya gumagalaw. So you suspect cancer already. Now, kung meron siyang skin changes, kinakain na yung balat, no? Again, that's a sign of invasion. So you think of breast cancer. Medyo advanced na ito, ha? Pag meron ka nito. No? Now, signs of spread, yung kanina, invasion, ngayon, signs of spread, pwedeng pumunta dito sa kilikili. Okay, lumipat doon. Okay, I mean, pumunta siya doon, hindi na lumipat. Meron kang original focus dito sa breast, tapos nag-spread doon, that's a sign of spread, so you suspect cancer. Ngayon, pero meron ka rin sa above the collarbone, ito yung breast, ito yung kilikili, ito yung sa leeg, no? Okay. Taas ng collarbone, kung may bukol doon, you also suspect cancer because it's another sign of spread. Okay. Sign of spread, signs of invasion. Okay. So, summary and takeaway. I'd like to repeat, develop BSE as a health habit. Make it as your first and mainstay screening and detecting armamentarium for breast cancer. You can complement BSE with a breast specialist examination and imaging procedures as needed and indicated. So huwag niyo kakalimutan yung BSE. Okay? So do not rely solely on the breast specialist examinations and imaging procedures as they may give false negative readings at the time of examinations. And if you do monthly BSE, you may be able to discover a dominant mass that may appear before the next checkup. This way, you will be able to discover a dominant mass early enough. Do not listen or be discouraged by negative recommendations on BSE. Marami kayong maririnig doon, especially sa internet, sa mga nagpo-promote na mga ultrasound, x-rays, okay, mammography, okay? And do not be afraid to do BSE as it will not cause breast cancer. Okay. Huwag kayo maniwala na BSE can cause breast cancer. Do not be afraid to do BSE because of fear of finding breast cancer. If there is breast cancer with BSE that you have done, it will be detected early enough. And do not simply say that you don't know how to do BSE to justify the reason for not doing BSE. You have to learn how to do it because of its usefulness. You can easily learn it as it is simple. Doing BSE, regular BSE, is an investment for your breast health. Nobody knows when a breast cancer will strike. Hindi natin alam kung kailan darating. We don't know the exact cause also. Kung darating. Kung hindi, swerte lang, no? So do monthly BSE so that once breast cancer strikes, you can detect it early enough. And with early recognition and early treatment, your chances of cure will be high. So if you don't do BSE and if a breast cancer appears and is already in the advanced stage, you will be blamed for this situation. So it shows that you did not love yourself and your body enough. Kung hindi kayo gumawa ng BSE, pagkatapos yung breast cancer na discover ninyo, advanced already. Okay. BSE as a health habit is simple and without cost, walang gastos. It can be repeated anytime without added cost. You can do it anytime and anywhere, once, twice, okay, repeatedly. It can detect breast cancer and other breast diseases. Hindi lang breast cancer, kung saan may mga sakit dun sa breast, not breast cancer, but others, benign, no, ganon. Okay. Madidetect din ninyo with BSE. It can detect early breast cancer as long as it is done regularly and properly, and as long as it is reported to a breast specialist right away, early enough. So consult a breast specialist right away once a dominant mass is detected during BSE. So again, hahanapin nyo yung dominant mass. Okay? Kung may dominant mass, red flag siya. Consult the breast specialist right away. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on breast self-examination. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the management of your breast health and in detecting breast cancer early enough in case it occurs. So, as I said, this particular lecture on BSE is in connection with the BSE award, Breast Self-Exam Award, which we discussed last week. Okay, just to repeat, the BSE award was launched in January 15, 2022. The primary objective of the Clover Awards is to promote early detection of breast cancers among Filipino women. The specific objective is to promote and advocate the practice of health habit called BSE among Filipino women so that in case of breast cancer strikes, they will be able to catch it early enough and have it treated as soon as possible. What are the mechanics in the awards? These are my mechanics. These are my strategies. I will teach the registrants on how to do this breast self-examination. Okay, this is what I'm doing now. Teach them how to interpret. Okay, I've taught you on how to interpret already today. And then document their performance of regular breast self-examination for at least 9 consecutive months with a report card and a video every quarter with clothes on. Okay, may hiya, may clothes naman, may privacy. Just wag lang isasama yung ulo, saka yung mukha, no? Okay. Para malaman ko lang kung talagang ginagawa, kung tama o hindi rin, no? So just a total of 3 videos in the span of 9 months. And then the other strategy that I'll be using this for these awards will be to incentivize you with certificates and cash awards. So examples, illustration on teaching the registrants on how to do breast self-examination. Okay. I will give you the links to the learning material, but just watch this short video. So palpating the breast, the left breast first, or pwedeng right then, pero nauna itong left. Then nakataas yung kamay while palpating. From upper, lower quadrant. Yung kamay hindi tinataas from the breast, nakapatong palagi at parang hinihimas kinakapa, no? Okay. And then after that, nawala. No? Ayan. Squeezing the nipple and then palpating the armpit. Nakababa na ngayon yung kamay. Para lax yung tissues doon. And then the same procedures will be done on the other side. No? Okay. Yeah, on the other side then. Okay. So this will take only about 3 minutes, okay, even with the video. Okay. So then, as I said, one strategy is to teach the registrants on how to do the breast self-examination through this lecture. Okay, and then through the online learning evaluation test exercise that you will be, the link will be given to you. And then I will teach you also how to interpret, which I've done in this particular lecture, and then document their performance, okay, for at least 9 months from February to October, at least. Okay, 9 months. 9 months lang naman to hopefully it will develop a habit already, and in 9 months para ma-perfect niyo yung correct way of doing BSE. So this is a sample of the report card. Okay, January, February up to December, and then video done. Ilalagay lang date dito kung kailan ginawa, no? Kung kailan yung ginawa the time na may video na isasubmit, no? And then on the third column, lalagay niyo findings, kung mayroong unusual findings or wala, kung wala, di no. And then kung may findings kayo, o kung wala naman, observe. Kung may findings, pwedeng observe, pwedeng i-consult na sa specialist. Okay. So incentivize them with certificates. Example like this. This is certificates given last year. Okay. And then coordinators will be incentivized with cash awards. Now for the coordinators, it will be receiving 500 pesos at least. And then kung may na-recruit siya, 100 pesos per recruited members. And then for the members of the coordinators, 500 each, doing monthly BSE for at least 9 months. And then there's another award here, Ayuda for Breast Cancer Discovered Early. Basta early na-discover at gumagawa ng monthly BSE, then there'll be an award of 5,000 pesos for each member kung may makita. No? And then, so to summarize the eligibility for the certificates and awards, there must be a report card, video with clothes on, and then perfect score on the OLETE, on breast self-examination. Okay, this is a sample of the certificate. Okay. So the awarding this year will be on December 1, 2024, during the 37th Cancer Crusaders Club annual Christmas get-together virtual meet. So do monthly breast self-examination. It is the best strategy against breast cancer. Simple, practical, no-cost strategy for early detection. Can save life against breast cancer. So look for and palpate for anything unusual on the breast. If there is anything unusual, consult a breast specialist right away. Okay. So the project was launched in January 15. We are continuing this award. This is our third year, 2024. Okay. So I would entice you to join these awards because try to convince your relatives and close friends to join because you can protect your relatives and as well as yourself. The deadline for submissions for registration is January 31. That's a few days from now. So remember, the objective of these awards will be to promote, advocate the practice of health habit called regular breast self-examination among Filipino women so that in case the breast cancer strikes, it will be able to catch it early enough and have it treated as soon as possible. Okay, so with that, I end my pep talk. I hope I have empowered you to have a better understanding of the importance of breast self-examination as a health habit in the light of high incidence of breast cancer. As a reminder, before the QA, take the online OLETE, okay, and then 50 OLETE certificates will entitle one to a voucher to a free ROJoson telemedical consultation, either face-to-face or telemedical. Then feedback, please type in your feedback and on the open forum and before we adjourn. Let's now have a group picture taking before we start the question and answer. Okay. Show your picture, show your face. One, one, two, one, two, one, two, one, two, one, two, three. Got it. Okay, so the floor is now open for questions, if you have any. Any questions, any comments? So today I have given you a lecture on breast self-examination, how to do it, and then how to interpret. Okay. Usually, yung mga lectures, yung nakikita natin sa internet, they only tell you how to do it, but they don't teach you how to interpret. Tama? Okay. So, mas maganda mayroong teaching on how to interpret the results of your findings. Na? I hope it will motivate more people to do it. Na? So, any questions? Who are willing to join the BSE Awards for this year? I know Shirley will be joining. Diba? Tama, Shirley?
Yes, sir. Yes, Doc.
Okay, good. Good. Sino pa? Sino sumali?
Doc, ilang members po yung minimum para sa...
But any number will do. No?
Okay.
Kasama ka na, Giselle.
Opo.
May isa ka na, Shirley. And then,
Opo.
so may 600 ka na kagad. Then, if
Thank you po.
you can recruit yung mga cousins ni Giselle o yung mga kapatid mo, Shirley, no?
Opo.
Pwede, no? So, it can be more than 5. Parang si Mayan, ang pinakamaraming nare-recruit ni Mayan, usually more than 5 nare-recruit ni Mayan. The past. Okay. Yeah, winner na winner talaga si Mayan.
Thank you po,
It
Doc.
can be more than 5. If you recruited more than 5, let's say kung 5, di may 1,000 ka. If you more than 5, baka 1,200 na ganon. Last time may ano siya, I think recruited 7 or 6.
Mag-join nga
lang
ako
po,
dito.
Dok.
Ah,
Malaki yung unang year.
ano, may
Mas malaki po yung unang year.
yung
10
unang
yun
year.
eh. Ngayon,
Mute mo nga.
Itutuloy mo pa ba?
Opo, Dok, mas marami po ngayon.
Mute. Anak,
Good.
pa-mute
So
na.
actually, you're not only helping me, but you're also helping your relatives, no? In
Opo
my
nga eh.
advocacy, no? Okay.
Opo, Dok.
So pag if you're able to help other people, ang feeling mo satisfaction, who knows, baka bigyan ka ng blessing ng God, no?
Amen.
Okay. Okay. So
Thank you
deadline
po,
is
Dok.
January 31, ha? Submit mo na,
Opo.
Mayan. Okay.
Name lang naman po, Dok, ano?
Name mo na. Okay. Perla, anything?
Parang gusto ko na rin mag-join, Doktor.
Sure, dapat.
Oo, kasi nawala na yung aking kwan. Kasi last week, nagpa-ano ako, Doktor eh. Ba yun? Nagpamamo ako at saka ultrasound of the breast.
Bakit?
Kasi may pinamamonitor ng doktor dito sa aking dede ba?
May nakapa?
Opo.
Okay.
Kaya gusto ko nga pumunta sa iyo eh.
Okay.
Opo.
Anong
Kung
results?
pwede. Andito doktor yung mamo ano ba nakalagay?
May suspecha?
Meron daw maliit na mass. Alam kung gaano kalaki na. Sabi ko, papunta nga ako kay Dr. Joson, magpapa-check up.
Bakit hindi doon sa doktor na nag-request niyan?
Kasi doktor sa aking card, kasi may card kasi ako, hindi ka
Ah.
naman kasi kasali doon, kaya sabi ko,
Aha.
pero gusto kong pumunta talaga sa iyo.
Okay.
Kung
Sige.
ipapaano ko to para to ano yung aking agam-agam ba.
Sige. You're welcome to see me. Okay.
Okay, kailan ba ang face-to-face mo, doktor?
Once a week.
Once a week?
Meron na ako ngayon mo lang. Hindi mo ba?
Pero 'di ba, doktor i-schedule pa or hindi na?
Yeah, scheduled pa. But ang tanong mo kasi kung nagpa-face-to-face na ako, matagal na ako nagpa-face-to-face,
pero
2022.
parang schedule pa, doktor magpapa-schedule na lang po ako.
Sige, i-contact mo na lang ako.
Ano, doktor?
I-contact mo na lang ako. Ang next clinic
sige,
ko will
doktor,
be February.
i-message na lang po kita kung kailan po.
Ang next
Para
clinic ko will be February 6
ipakita ko
na
sa iyo.
Okay. So once a week lang ako. February 6 will be my next.
Once a week? Mga Tuesday, doktor, ganon?
Mga Tuesday, pero ina-announce ko kumisan pag may holiday na Tuesday, ginagawa kong Thursday, o kumisan I'm not available, no? So I put it on the Thursday, no?
O i-message na lang po kita sa Messenger po, doktor, kung kailan po.
Sige, you're welcome to join. Kahit na
Okay,
wala kang
doctor.
breast cancer, kasi as I said, knowing how to do BSC can protect you also from breast cancer habang wala pa. Okay?
Opo.
Okay. Any more?
Doc, sorry po, Doc. When are you going to send the link?
Which
The
link?
sample? The BSE? BSE?
May ano sa ito? Nagtatanong?
Apo.
Meron na akong nilagay ng link doon sa primer.
Sige po.
Nasa
Check
Facebook.
ko lang po.
No.
Oo nga pala. Sorry po. Kalimutan ko. Sorry po.
May primer ako, andun na yung link. No?
Nakita ko nga pala. Sorry po. Sige po, check ko na lang po doon ulit.
Okay.
Sige po.
So, any more? Rona, sali ka, Rona?
Sige po, hanap po ako nung mga ka-office ko pong i-recruit.
So, okay. Hindi sa ikaw tinatakot ko, ha. Yung kahit Rona kasi if you has thyroid, na.
Anong
Doesn't
sabi?
mean libre ka na sa iba, di ba? So, the other areas can be affected. Kung minsan, ovary, kung minsan breast, ano, di ba? Okay. So, be on the lookout. Be on the lookout for all these type of diseases that can occur in a person's body. Kaya pinaka-practical ngayon is really to do a self-examination of all your entire body eh. Kasi kung kasi yung mga tinuturo sa ngayon, mag-focus kayo ng breast, hanggang breast, nakatutok lang doon, eh knowing that any parts of the body pwedeng tamaan, di ba? Okay. So the most practical way to protect yourself is to master yung mga self-examination bilang sa breast, thyroid, no? Self-examination. Yan ang pinakamura eh, di ba? You don't have to spend basta marunong ka lang kumapa ng legs for your thyroid, kumapa ng abdomen sa tiyan, no? Ganon. No? So, usually madidetect mo ng early yung mga cancer kung may lumabas, na? Okay. Wag kayo ang tinuturo ko, wag kayo mag-rely ng mga test, na? Kasi yan ang palagi pinopromote ng mga hospital, mga clinics, okay, sasabihin niya, magpa-test kayo dito, magpaganon kayo, no? Okay. Without promoting yung self-examination, no? Okay. Tama? Tama ba ako? Okay. Any more? Si Belet, sasali na si Belet yata, no? Belet?
Ay, magta-try ulit akong mag-recruit.
Oh. Mag-recruit ka, there's an enjoyment, tatanong mo kay Mayan, there's an enjoyment, satisfaction on helping other people, no? Okay.
Diba?
Wala si dito, si Seni Cabral, no? Pero
Doktor,
yeah.
Doc, halimbawa, di ba po, ang ano natin is sa 31, pwede pong halimbawa malate magpasa ng magiging bagong member.
Yeah.
Kasi, di ba po, yung dati kong kinuhang member, ina-encourage ko po sila din po kumuha ng pwedeng member nila. Kasi
Pwede.
gusto nila, kasi tulad po ni Emeline Balbin, sabi ko, may mga kapatid ka, baka pwedeng i-encourage mo sila na gumaya sa ginawa mong BSE natin kay doktor. Yun po yung ginagawa ko palang, Dok. Kaso, inaano ko pa rin sila na i-message isa-isa. Baka po mamaya, hindi po ako makaabot ng sa 31. Pwede po kahit late na ulit
Pwede.
magsabi.
Pwede. Maka-adjust ko lang. Basta ma-fulfill lang in 9 months. No?
Okay po. Sige po.
Okay. Mahabol yung 9 months. No?
Opo. Thank you.
Kasi knowing yung way of doing things, pag hindi ko maglagay ng advance deadline, delay.
Yes.
Hindi
Opo.
na aabot. No? Okay. I'm willing to adjust. Basta importante yung 9 months. No? Okay. So, pwede magsimula ng February. No? Ganon. Pwede.
Opo, Doc. Sige po.
Okay.
Okay.
So, as I was saying, may isang tangible benefit na nakuha natin dito, no? Which for those who are following me in my Facebook, yung si Seni Cabral, sumali sa BSE, yung kapatid niya, sumali rin as a member. And then last year, while palpating her breast, may na-discover siya ng maliit na breast cancer. No? Okay. And because of ginagawa ng BSE, kaya may na-discover niyang maliit na breast cancer, no? Stage 1 lang. Stage 1 or 2, gano'n. No? And then, nagpa-opera na. No? So, inopera na. No? So, binigyan ko ng 5,000 pesos ayuda. No? Gano'n. No? Okay. So, that's one of the other tangible results of this project. No? Okay. So, I'm just hoping a lot will join. I'm not hoping a lot will discover my breast cancer. Okay. Mas maganda yung basta marunong lang kayo gumawa, no? Okay, secondary na lang yung ayuda, di ba? Okay, secondary. No? Okay. So, if there are no more questions, may tanong pa ba? Abet, you want to add something? Anything you want to add? Abet?
No more. I will just regroup my members na nag-decline last year. So
Mhm.
most probably I will be able to recruit them again.
Sige. Sige, mag-recruit na kayo habang may pondo pa. Hanggang may pondo pa. Okay. So, ang kailangan ko pa 100, probably 111 o 18. Basta may target ako, hanggang 200, ititigil ko na ito. No? Okay.
And because you're not going to hold clinic on Wednesday, Tuesday, and your birthday is on Wednesday, we would like to greet you a happy birthday.
Thank you.
Advance happy birthday, Dr.
Happy
Ray.
birthday, Doc.
Thank
Happy
you.
birthday, Doc.
Thank you.
Happy
71 na
birthday,
ako.
Doc.
We won't be seeing you for the whole week, only on Saturday. But anyway, we can do it also a late birthday celebration. So
Yeah. Okay.
advance happy birthday.
Advance happy birthday, Doc.
Advance
Mag-appear
Thank
po,
you.
Doc.
birthday po, Doc.
Doc, GSIS na pala. May appear doon po eh.
Ano?
Sa GSIS, di ba, pag birthday mo, Doc, mag-appear po kayo doon.
Nag-appear na nga ako.
Nag-appear na po kayo?
Oo. Sinabi ko, buhay pa ako.
Ako nga rin, Doktor, pupunta ako doon eh.
Ako by online.
Hindi naman sila nasagot kasi nung pag ako
Matagal.
kaya.
Matagal sila
Ang
sumagot.
tagal, Doc.
Sasagot sila. Sumasagot din. 2
Eh, di
taon.
ko naantay.
2 taon
Di ko
na
na
ako
naantay.
gumagawa nun.
Nagpunta na
Online.
ako.
Oo. Hintayin mo lang. Sasagot sila.
Opo.
Nung umpisa, anxious ako. Baka hindi sumagot. Baka ma-cancel yung ko. Ma-delay yung pension ko. Di ba? So, eventually, sumasagot naman. Okay. So, thank you for the greetings. I'll be celebrating my birthday outside. Yung anak ko nga, umuwi dito para mag-celebrate ng birthday ko. Kaya lang, sabi ko, hindi mo sinabi sa akin. Kasi meron akong scheduled mission sa Tarlac. So, I'll be celebrating my birthday in a mission. Mission sa Tarlac na surgical missions na. Okay. Okay. So, kung wala na, we'll call it a day. Okay. Yung next week will be, it's either ito tinatawag na cancer surveillance after a definitive treatment. Tinatapos ko pa yung lecture, na yung how to monitor yung mga cancer after a treatment, na whether to do a maraming lab test, di ba? Okay. Or just yung mga as indicated lang, na okay. Anyway, I'll finalize the lecture this weekend, no? Para I'll announce it, no? Okay?
Okay.
Okay, Doc.
Okay. Bye-bye.
Bye-bye po,
Happy birthday.
Doc.
Thank
Happy
you.
birthday.
Happy birthday po.
Thank you. Thank you.